Hello everyone. Today we are going to discuss about shock. It is a very important topic. First we are going to discuss about the introduction part. So shock is a state in which the oxygen and metabolic demand of our body are not met by cardiac output. So basically shock is that state in which our body not get proper amount of oxygen, nutrients, how much our body normally need. When this process occurs in a single organ rather than throughout the body, organ ischemia and infarction ensue. When this process happens in a single organ, not all over the body, that time we call it ischemia, like we heard about the ischemia of heart. When shock occurs on a more global level, multi-organ dysfunction and failure are consequences, ultimately leading to death if not corrected. When shock occurs on a more global level, we can see different type of organs are not able to function properly, and it might cause failure to those particular organs. And if we not take any action against those problems, ultimately it leads to death of the patient. Shock is more often accompanied by hypotension. So shock is most commonly happen with hypotension, and it termed decompensation shock, and it is termed as decompensation shock. Shock may also occur with normal or elevated blood pressure. So shock may happen with low or high BP patient. After the introduction, now we are going to discuss about the definition. So shock is a life-threatening medical condition in which body suffers from insufficiency but blood flow throughout the body, circulatory collapses. So it is a life-threatening condition because if we are not treat shock on time, it can cause death of the person. So it is called as a life-threatening condition and emergency condition. It is characterized by inadequate tissue perfusion in which there is insufficiency delivery of oxygen and nutrients to the body tissues and inadequate removal of waste product from the tissues. So in shock, we see a condition where blood flows is less in a body tissues. Because of what? How much oxygen and nutrients our body need, blood is not able to deliver that proper amount of oxygen to our body. Also, waste product of our body tissues are not able to remove. That means it is not able to excrete properly, and if untreated results in cell death. So basically it is an emergency condition. If not treated on time, it may cause patient's death and cell death of the patient. So after the definition, now we are going to discuss about causes. So what are those diseases or those risk factors that can cause shock? Number one, heart attack or heart failure. So as we know, what are the work of our heart? It pumps the blood throughout the body. So if there is any abnormalities or dysfunction in heart, like myocardial infarction, heart attack, that time patient's cardiac output will not be able to maintain and heart is not able to pump out the blood properly throughout the body, and we can see the condition of shock. Number two, allergic reaction. So in a hypersensitivity reaction, blood flow may stop in the body tissues. Number three, hemorrhage. So hemorrhage means bleeding in body tissues, if there is any external or internal injury happen because of what blood loss, that time it can cause shock. Dehydration. In dehydration, a large amount of body fluid is lost, because of what shock might be occur. Burns. If a patient is having severe burn, that the patient might be lost their body fluid and it may cause shock. Infection. Different kind of infection also may cause the shock. And now vomiting and diarrhea. So this in vomiting and diarrhea, our excessive body fluids are removed from our body. If a patient continuously have vomiting or diarrhea, at that time patient may have shock. So here the persistent word is used. If a patient is continuously having vomiting or diarrhea, that time only the patient may have shock. And the last cause is poisoning. If a patient is having any kind of poisoning, that time also the patient might be going in a condition of shock. So in further video we are discuss about the types of shock. Thank you everyone.